Let's tackle this NCLEX question of the day. An adult med-surg nurse is being floated to a pediatric unit to help with short staffing. Which patient assignment would be most appropriate for the adult med-surg nurse? Now, these management of care questions can get kind of tricky, but this is what I do to help me in these situations. So if I have an adult med-surg nurse being floated to a different unit, I'm going to be looking for a patient that has a diagnosis that I would see in an adult med-surg unit. Okay, we're being floated to pediatric unit, so if I see a specific peds diagnosis, then I'm not going to give that patient to my adult med-surg nurse. Also, if I have a pediatric diagnosis but they are unstable, then I'm going to hold off and see what my other options are. Now let's run through the answer choices. So option A, patient in sickle cell crisis with an order for intravenous morphine every 2 hours PRN. Now, sickle cell crisis is pretty common in the pediatric unit. However, you can have these crises as adults. So I'm going to leave that option open and move on to option B. Patient with a new diagnosis of type 1 diabetes mellitus who needs discharge instructions. So type 1 diabetes mellitus is typically diagnosed in your adolescent teenager years. An adult med-surg nurse is going to be dealing more with type 2 diabetes mellitus. So I'm going to cross this one out. Option C, patient with pneumonia receiving intravenous antibiotics saturating 99% on room air. So pneumonia is a very common diagnosis in the pediatric, but mainly in the adult population. This is a good option for me, and it tells me that they're stable, so I'm going to leave it open. And option D, patient with left lower quadrant rebound tenderness that expresses sudden relief of pain. So this is acute appendicitis that has ruptured. This is pretty unstable. Appendicitis is seen more in the younger population, so this is not really an option that I want to give the adult med-surg nurse. So we've narrowed it down to option A and option C. Option A is in sickle cell crisis. Remember, there's sickle cell disease and they can go through remissions and exacerbations. So if they're on exacerbations receiving intravenous morphine, that is a little bit more unstable than somebody who is receiving antibiotics for pneumonia in option C and saturating 99% on room air. So based on that thought process, the answer is going to be option C. I hope you learned something by doing this question with me. Unfortunately, most management of care questions are situation based, so there's no specific outline on how to tackle them. But in these situations, when you have a nurse floated to a new unit, just think to yourself, where are they coming from? Who do they take care of? And which of these 4 options will they likely come across on their unit? Because we want to practice safely. All right, I hope you learned something. Follow for more NCLEX questions of the day.